Hi, welcome to Healthcare in Context. My name is Charlotte Seyfried. I am a breast cancer survivor, a caregiver, and a patient advocate, and I'm the founder and creator of charlottepxp.com. And this is my partner.
Hey, I'm Caitlin Holcomb, founder of Wellness Communities. I'm a certified community health worker through Baylor Scott and White, and shortly after earning my MBA, I quit my job to start focusing full-time on helping people to dwell in wellness. And welcome to our series, Healthcare in Context. We call it this because contextual care matters. In fact, evidence shows that paying attention to contextual care factors improves the likelihood of positive medical outcomes by 70%.
We want to remind everyone that we are not doctors. Anything we say here is not to be construed as medical advice. Welcome back, Andrew and Ryan. It's so good to see you again. Thank you for joining us on Healthcare in Context.
Thanks for having me.
Great to be with you.
Andrew, just kind of opening it back up to you, did you have any other comments or anything else you wanted to add around potential improvements or barriers along the way?
It's just like absurd to me that like both like during like the like heavy part of the treatment and afterwards, like I mean it's just been like 10 years, right, of this, that it just really stands out to me that they haven't solved that, right? It's all like sort of one hospital. I will say that like and this could just be a pandemic phenomenon. I did kind of run into trouble with like handoff from one oncologist to the next, right? Like so like you know my oncologist kind of left during the pandemic, and I was passed off from like one like successive oncologist to the next, and so now I was getting kind of like my like check-ins. There was a lot of like ball dropping, and I couldn't really get an appointment. It was tough to get an appointment, and I finally kind of wrapped up my 10-year sort of a round of appointments, like maybe like a year late, just because it took a long time. Yeah. So I feel like once you're kind of like and move far along and you're kind of getting out of the system, right? Obviously there isn't that urgency there, but I did have some challenges, like kind of wrapping up, I guess you could say, the recommended surveillance treatment at the end there. And I feel it was like more of like a pandemic thing, right? Like that the people had retired, like with the family that I had kind of gotten used to, there a lot of them were gone at that point, right? I feel like there was a lot of change in hands, like around the time of the pandemic. Just in general, people moved on to different hospital, that sort of thing.
That's helpful. I know the statistic that comes to my mind, because I like numbers and I'm a nerd, is the average American spends 2.5 work weeks each year simply coordinating care. And then when you pile on something like cancer or other chronic conditions, or caring for dependents, caring for parents, whatever, that number obviously geometrically multiplies. So yeah, I could see how you're working full time, you have a family, you have stuff that you have health things that you're trying to comply with, and it's just the time and energy suck of complying makes it a bit more difficult to do so. Charlotte, I think you were going to add something too.
Yes, I was thinking when you mentioned that your doctor retired at a certain point, when I was initially diagnosed with breast cancer, my PCP was retiring. So it's one of the reasons that I probably never received any kind of communication about my cancer diagnosis. No one called me at all, ever. And I have been to and sat on panels where we were talking about doctors retiring, and those doctors sat down with every patient, said that they were retiring, matched them up with someone they thought would be a great oncological fit for them. And I wish that was the practice in every healthcare situation.
I think for this next part, Andrew will start with you, and then Ryan will come to you, thinking about getting that care team in place. the context of everything that we've discussed so far and keeping up with that care plan, you mentioned the medication spreadsheet. What are some things that you wish you would have known? And what you wish you would have known or would like to have told people who are maybe at the beginning of this journey, what also helped make things easier?
Yeah, that's a good question. I guess I didn't know going into it that how long you had to live with uncertainty, right? I don't know. I felt like I don't know. You get into the treatment and they scan you quite frequently, right? And then maybe you feel like things are going in the right direction, but actually it takes like years before you feel like safe in a way, right? Like this treatment has worked, right? And it's something that's like kind of constantly on your mind, even after you get out of like the sort of heavy like chemo like phase. And I didn't really realize how that would be, right? Yeah, I kind of felt like yeah, I was in a very different kind of psychological state, maybe for years afterwards, right? Um, yeah, kind of like always living with that uncertainty, right? And I thought like, oh, you get your treatment and either like works or doesn't, and then you kind of move on or something. But yeah, it lingers for sure. Yeah. Um, but in terms of like practical things, oh boy, I guess ask for it, right? Like I didn't know that you could. I just kind of I don't know. Maybe I'm an extroverted person, but like I would ask for all kinds of extra things. Like, can you open an hour early so I can go to work, right? Like, it is possible. They may accommodate you. Like, go for it, right? Why not? You know. And the number one thing is to have a partner, right? I just was like incredibly lucky. My father was kind of retiring around that time, and my parents have like both like I don't know, they're kind of like together because they lost their fathers very young. Like I think that was like a sort of bonding kind of like moment from cancer, right? So it's like a big impact on my family, right? And they're panicked, right? Like they're thinking, I think of all kinds of their own right experience, and I think in a funny kind of way, like help for them to be present, right? Be part of my care, right? And so I got a lot of like very personal, someone I couldn't really drive at a certain point. It was like difficult to drive. I got kind of fuzzy headed and, especially in those appointments where they're giving you a lot of information to have that second person along with you, right? I mean, I felt so incredibly lucky that I had that, right? And someone like this, like kind of companion that I could hang out with, right? That would we'd kind of hang out and like read the paper together while I was like getting like chemo and whatnot. And boy, if I don't know what I would have done without that relationship. That was just critical to surviving it all, with like my mental health intact. And I wonder how people do it on their own, right?
Thank you for that. You mentioned something that if you're willing to dive into it a little bit more, I'd love to hear about. You mentioned that it took a few years to feel safe. And I've heard psychologists talk about when you go through a hard traumatic experience that you go into, literally in this case, survival mode, and you develop this warrior posture, and getting out of that surviving mentality and warrior posture can take quite a bit of effort. I know that you mentioned that you were able to tap into some mental health support. What helped you feel safe again?
I don't know, just time, I guess. Like really, I don't know, time and like good results over time, ultimately, and distance between, you know, yeah, I mean, definitely made a lot of changes in my life. That's for sure. Like I was like engaged to be married. I, kind of like thought about that relationship wasn't working, right? And I broke up with my fiance at the time. I kind of bounced before, but like, I got a couple of jobs. I kind of job hopped a lot for a couple of years afterwards, like, cause like, I don't know, something wasn't satisfactory to me. I thought, well, forget this. Like, I'm just gonna leave, go somewhere else, kind of thing. Where I wasn't that kind of person before, you know. I don't know, like taking some unnecessary risks, to be honest. because I felt like, I don't know, you don't know how much longer you may have to live. I don't know, that sort of thing, right? And I would say like 5 years in, I felt after kind of felt like, oh, I'm going to have a future now, and I can think more long term finally again, right? And I met like my wife and got married and settled down more, and I've been in the same job now for 10 years, and when I'd always wanted to get a master's degree, for example, and I kind of put that off. I felt like, who knows, and and it's part of the recovery. I kind of went back and did that right when I realized, I felt like safe about my future, I guess, right? I'm glad I did. So yeah, uh, some good things and some bad things, right, from that flow from that.
Thank you for sharing on that. Ryan, coming to you. Would like to hear a little bit more about, if you could talk to yourself or people who may be at that kind of finding their care team and developing a care plan stage, what you wish you would have known, and then practical things that helped make life a bit easier.
So, like I said before, I think the biggest thing I wish I would have known is that you can go outside of, your local area to seek second opinions, to get additional information. It may not always be possible, but you can, see if they have a virtual option. If the barrier is transportation, I think I mentioned it before, but there are so many resources that are out there for people. And I wish that was something I had known. I was very fortunate that I had people to come with me to these appointments, to hear, be a second set of ears, to take notes, to help me make sure that what I was remembering is what actually was said. But there's, if you don't have that person, if you're not privileged enough to have somebody that can go with you, like, you can record those meetings. There are resources that are available, notebooks that help kind of like guide you through the questions that you can and should ask of your care team to make sure that you're a good fit for one another. There's just so much that's out there, and you don't always hear a lot about it whenever you're going through, picking your care team, talking through all of those pieces. I think the other thing that I would say that would be really nice to know and like hear at the beginning is that there is no one right way to go through cancer. And there's a lot of toxic positivity in the cancer space. There's a lot of people really wanting you to just, be positive or, have a fighting spirit and all of these things. And that can feel really dismissive and isolating to people. You can feel your feelings. It is okay to be scared and to be uncertain and to be sad and to grieve the loss of what you are losing through this cancer journey, because you do lose a part of yourself. You may come out on the other side a different person, but it's okay to like not be okay. As cliche as that sounds, like, it's true.
You're so right.
Thank you. And I like hearing also, it's the second time around that I'm kind of hearing from both of you about how helpful it was to have someone there, just physically being there. It doesn't have to be somebody who particularly knows what you're doing. They can just be there to take notes, can just be there to keep you company. But when you're sitting on the other side and it's somebody that you love, but you don't have the lived experience to know how to help, it sounds like just showing up and letting whoever it is you love feel whatever they need to feel is a tangible way to be able to help. So thank you for sharing that. And I appreciate the call out that if that's not there are
Ask.
also, ask.
Just like Andrew said. Yeah.
Would be like, yes, absolutely.
Yeah.
And it just doesn't occur to them. And then two, there are other resources about like free recording apps and free things online about questions that you can think of to bring to ask to your doctor. Before we close out, I want to open it up. Andrew, Ryan, is there anything else that either of you would like to add?
Yes. So I would say also utilize your nurses. If you're going through chemo, if you're going through radiation, like the nurses that are on that floor that are taking care of you are going to be a wealth of information to share with you things, tips, tricks, things that are useful. There's so many lists of things to bring to chemo or lists of stuff to buy when you're going through treatment, and the reality is that a lot of it is unnecessary. And if you are in a position where like finances are a struggle, those nurses are going to help you to sort through what is actually worth your time and your money to get, and what is absolutely just secondary and nice to have, but not essential.
I
That's a
love
great
that.
tip.
Yeah, a list can only be one dimensional because it's meant to be broad encompassing, but the nurse adding that personal color of, yeah, but that doesn't necessarily apply to you, is a good point. Andrew, any parting thoughts for us?
Yeah, no, I wouldn't really want to second what Ryan said about like nurses. In some ways, like the nurse, my main nurse, that was my primary relationship, and so much practical advice to like, I don't know, make your quality of life better, and whether it was like recommendations on what to eat, or just like how to take care of like I don't know, they had a pick, kind of thing, and I don't know, best practices around that so you don't get it all dirty or whatever. And I don't know, that was a very intimate relationship, and like I felt like the quality of the care kind of flowed from there in a way. Yeah, just boy, Ryan, your comments remind me of how like little limited bandwidth you have, right? For I don't know, just nonsense, especially. Kind of just listening to you, like, in addition to like happy talk, stuff like, you get also like a population of like friends, family members who have like these insane kind of like cure
Yeah.
kind of things like that they're recommending to you. It's just absolute nonsense. I was like horrified by that actually, and I found like just like cutting myself off from everything except just the people I felt were really in my corner was like important, right? Like I didn't have bandwidth to like hold people's hands around. I don't know, making them feel better about me being in a jam. You know what I mean? And yeah, so yeah, I really second your comments. Yeah, very well said. Yeah.
I like that. No bandwidth and for those of us who haven't gone through it, something to bear in mind, making sure that we're not making it about the person we love needing to make us feel better about
Yes.
their cancer.
That's a huge thing. And also letting them know that it's okay to speak to you about cancer, because oftentimes I know that there were lots of relationships where I tried not to bring it up because I didn't want to make them sad, and all it did was make me seek out my own community more. And if you really want to be there for that person, then you need to make sure to let it be about them as much as you can. I mean, I know we all have feelings, but if you can try to control your own emotions and let them feel their feelings, there's nothing safer and better in the world than knowing that you can talk to somebody about something bad in your life and not have to comfort them through it, and that you can grieve who you used to be, because it is sort of a grieving process of missing your former self who wasn't always constantly worried about this thing happening that can make them sick and take them away from the people they love.
Ryan, Andrew, I want to thank you both for being willing to be exceptionally vulnerable and to go into your stories more. I know that if even one person hears this and can hear the wisdom that both of you shared today, just thank you. You're appreciated.
Thank you so much.
Thank you.
My pleasure.
We'd like to give a big thank you to our guests, and we hope that you'll join us for the next episode. Context is everything, and healthcare and life. If you believe in what we're doing and want to support us, please remember to like, subscribe, and share our channel. Reach out if you want to be on our show, or you think we should cover another topic. What did you learn from the show today? We want to hear from you. Contact us at hcincontext@gmail.com. Leave a comment or look us up at wellnesscommunities.com. One of the most common questions I get asked as a cancer survivor is, what should I send to my loved one who was recently diagnosed? So that's why I helped create a curated list of products at wellnesscommunities.com in the Shop tab. It contains products that are tested and recommended by the people on our show, including me. We'll take a portion of proceeds and donate it to Undo Medical Debt. For every dollar donated, it will pay off $100 of debt. It also helps us continue to share these stories with you. We wish you wellness. And if you aren't feeling well, remember, there are people out there working hard to make you feel better. See you soon. Until then, take care of yourself and stay cozy.